Hello and welcome back. We are at the 48th Annual Conference of Endocrine Society of India. This is day 2, and in conversation with us we have Dr. Mangesh Tiwaska. He is the General Secretary at Association of Physicians of India. Well, sir, talking about the evolution of endocrinology, and since you have been a very crucial part of the association at the Physicians of India, alongside many institutions and so many meetings and conferences happening all the way through, what has been the journey like since ever and till date?
Yeah, okay. I still remember my old student days, and that was a pretty nostalgic question, let me tell you that. And I remember my student days, and attending a conference that to of a national level used to be probably the dream of every postgraduate student of medicine that time. And since the time I have started understanding the whole concept of medical education and continuous medical education and the importance of continuing medical education program, I have slowly started realizing in this journey that still we have a lot of lacunas to fill in, even though we are definitely doing better in from where we have started officially. But I still feel that at the tertiary care level we have a lot of information available, but at the primary care level, where people in the tier 2 or tier 3 places or in the remote places where primary care is also one of the most important needed things there, and we still lack not only in the numbers of the doctors which are available, but the updation and the knowledge that we have. So the journey is wonderful, I'll tell you this, that journey is becoming better and becoming better every leaps and bound with every conference and congress happening, every meeting that is happening. But still there is a lot of things, there are a lot of things which have to be done.
Let's talk about the odds that we find in this industry, in the Department of Endocrinology, also that the scope of improvement. So what do we really look forward to? Where are we lacking and how do we overcome those situations?
See, most importantly, we need to understand now the era, especially in the tier 1 cities or in the metropolitan cities like Mumbai, you see that people have that awareness of going to the specialists or super specialists. They easily can seek help. They are better informed people. The technology can be used in a better way for them. So here they have got a system which works for them. Here they have technology which works for them. Here they have informatics that works for them. So easily the people in the metropolitan cities or to some extent in the tier 1 cities of India, they have these advantages. But as you go down to the tier 2, tier 3 cities, it all boils down to only primary care people or very few specialists, those are available to offer that kind of a care which actually these people they deserve. So the basic lacuna is that creating that awareness about the subject, about the specialization and the need for doing that, which will surely improve the outcomes, not only as far as the patient treatment outcomes are concerned, but also as a whole, as a doctor, a young guy who is practicing in these kind of areas, he is updated well, so he updates himself with the latest happenings. Not only he updates himself, the same knowledge gets percolated in his practice, and ultimately the patients are benefited in the treatment.
So to fill in the gap or to connect the bridge, ESICON 2018 has played a role. Do you agree?
Yes, 110%. And in fact, all the endocrine conferences or even the Association of Physicians of India conferences, which is popularly called as APCons, which are happening, are basically the congresses which are designed in a such a way that you have got a whole platter of different subjects, right from the basics to the latest. All are covered, all topics are covered adequately in all these kind of congresses.
Sure. And talking about the scientific program here at ESICON 2018, diabetes and inflammation has been the talk for you yesterday in the session symposium. A quick keynote address to our audience watching us live.
Oh yeah, thanks for asking me that question. Actually, this was very interesting subject which was given to me to speak on diabetes and inflammation. And this is one area of diabetes which is not yet explored adequately. Even though we knew that there is an association between inflammation immune system, metabolism, and diabetes. They all fit in and they share the same plate. But the trouble is this, that we are not still able to establish the therapeutic choices adequately to treat a very, very important missing link in diabetes. Inflammation is blamed for many things. Inflammation is also called as a killer disease or a killer situation or a killer, I would say, punch that any patients, those who have diabetes or a heart disease or a kidney disease, because inflammation is responsible for not only diabetes or metabolic diseases, but inflammation is responsible for causing the cardiovascular diseases, inflammation is responsible for causing the cerebrovascular diseases, inflammation is responsible for causing cancers in such a way that, if we have got a good interruptive therapeutic choices to treat inflammation very smartly and adequately, in fact we can surely get down on the numbers of different kind of these complications which are usually because of the inflammation.
Sure, sir. We have just rightly spoken about the conditions and the complications. Also, would you like to add something as far as the therapeutic drug monitoring is concerned and how to figure things out there?
Yeah, in fact there are a lot many areas where you should be you should be focusing on, I would say, in most of the conferences. And as you have correctly pointed out, this that monitoring is the biggest barrier, no matter it may be the monitoring as far as the drugs and therapies that you are concerned.
Yeah.
As far as the simplest are the blood sugar monitorings or HbA1c monitorings. Those are also problems in the management of the diabetes. People, they do not do not only the regular blood sugars in the laboratory, but they do not even do their self monitoring of the blood glucose.
Correct, yeah.
They even do not visit the clinic regularly. So all those things, are still the gray areas in the diabetes management.
And I hope we'll be able to overcome with better awareness, filling in gaps.
Yeah, in fact, this kind of conferences or congresses not only enriches the delegates, but also the same message is passed on to the community at in some way or the other. The whole thing gets ultimately percolated to the beneficiaries, and which are going to be the patients.
Well, thank you so much, Dr. Tiwaska, for joining in with us here on ESI TV.
Thank you
Once again.
Thank you for your patient listening. Thank you very much.
Sir.